what are the current challenges of the digital workflow in our daily practice? Let's review them. First of all, technical complications. I have to tell that the number of technical complications is really decreased, but still we have them, and they're happening at 3 different levels: at the prosthetic level, at the abutment level, and at the implant level. We can have implant fractures. The percentage of implant fractures is really low, but when it happens, it really affects your clinical practice. Then biological complications. We now recognize that the contour of restoration has a huge impact on the health of peri-implant tissues. And the contours of the crowns are often dictated by the position, 3D position of the dental implants. So we have to improve that aspect of our clinical practice as well. Then immediacy. We don't have to apply immediacy in every case, but I'm applying it, I could say, at 80% of cases in my clinical practice. So we have to combine surgical techniques and prosthetic techniques. We have to combine both workflows, surgical and prosthetic, into the planning. We have to fabricate the guides, immediate prosthesis, or healing abutments. Going to the dental chair, the digital workflow, sometimes it's too complex. We have so many devices. Look at the armamentarium for the digital workflow. It could be really too complex. Intraoral scanners, photogrammetry devices, face scanners, dynamic navigation, different sets for guided surgery, for scanning, scan bodies, jaw tracking devices, laboratory scanners, and 3D printers, and needless to say, digital camera. So to integrate all of these devices, it's sometimes too complex. And we have to minimize the number of equipment just to leave those that work reliably and provide us value. Another challenge in the digital workflow is that we have quite many well-working techniques. For example, capturing the position of scanned bodies. I think we did a great progress with that. However, it's not enough, because in clinical practice, we are not only capturing implant scan body positions, but also we are registering the bite. So if our intraoral scanner or our technique works well with capturing scan body positions, but it fails with the accurate registration of the bite, then we are in big problem. So in the research paper we can have nice results, but in the clinical practice we will not be satisfied with the performance. So talking about implant supported restorations, and when we hear this word fit of the implant supported restoration, we always think about the passive fit. But I think that the passive fit nowadays is a partially solved problem, is not that huge. And if you have the digital workflow which provides you a perfect passive fit, will that be enough for you in the clinical practice? Unfortunately, no, because there are so many other criteria for the fit. It's not only the passive fit, but it's also the proximal contact fit, occlusal fit, the contour, emergence, contour of the restoration, cleansability of the prosthesis. So there are so many fit criteria for our implant supported restoration. That's why I call it like a total fit concept, total fit workflows that we have to provide in our clinical practice to satisfy all of these criteria. Only then we'll be successful. And to do that, we have to organize our workflow in appropriate way. So we have certain procedures and we have certain techniques at each clinical or laboratory step. So I work in a clinical practice and I organize my workflow considering these 6 stages. So in the first one, we do the treatment planning, we find out prognosis of the teeth, then we obtain the digital images, then we create the digital patient, we do the planning. In the second stage, we fabricate the guides, the immediate prosthesis. At the third stage, we perform guided surgery and immediate loading. After the healing, we take digital registrations for the case, then the case goes to the lab. The lab procedures also has to be organized to maintain that level of the accuracy that we obtained at the stage 4, and then stage 6 is delivery of the final restorations. And the aim nowadays is to deliver the final restoration without try-in appointments. Is that always possible? No, but the percentage of cases I'm able to deliver without try-in appointments is increasing. And this is very important because it saves time. It's again elevates the effectiveness and efficiency of your clinical practice. So in short, the purpose of the digital workflow, and namely the total fit workflows, is to organize the workflow, all the steps, treatment planning, lab steps, surgical procedures, prosthetic procedures, in that way that from quite complex situation with a guided surgery, with digital tools, we can go smooth, in a smooth way, and I can say more or less effortless way to achieve predictable results, as it was in this case, or again another case that we'll see in the upcoming presentations, from here to here with well organized procedures. So again, those 6 stages, keep them in mind always as you plan the case, as when you organize the treatment.